Both.
Sensory or motor?
Both.
Okay, what's the motor?
Facial
facial
reflex.
expression?
Motor?
Eyelid open closure, like this. Open and close.
Like lifting your eyebrow.
Like that. Close your eyes.
Puff your cheeks. Smile. Frown.
Sorry.
Pouty look or something. Okay, so that would be movement across there, the facial muscles on there as well. So what is the sensory? Fritz, you said it? That sounds like trigeminal. None?
Lip closure.
So you're saying it's motor, but we said it was both. Say what? It's the anterior portion of your tongue. So we tasting in the anterior portion. Okay, 8. We already did 8.
For the sensory is that you put sugar,
Who's
salt on
thinking
the
it's
tongue.
sensory or motor?
But we don't test that usually. The
Okay.
sensory part is
9.
deferred, so it's usually motor.
Glossopharyngeal.
Nasopharyngeal, both. The gag
Is that
reflex.
a
Tienen que coger el tongue depressor. I saw on YouTube. They gave the patient a little glass of water. Y tragó.
So you might check that glossopharyngeal when you do right, you do lift. And where that would be that or gag reflex, I don't like that as much, that one, right? Right, they're actually both related to it, right? They're both innervated for 9 and 10, but now what's the sensory of 9?
The taste.
Right, posterior part of the tongue, that's how it's innervated. They're not typically done, right? Because we don't have like a snack bar at our, or anything like this, right? Pastelitos or something like that, right? Sweet ones, salty ones, trying it out, right? 10?
Vegas.
Alright, so what's the motor part of it? Swallowing, because the innervation is back to where? So you can see that with 7, 9, 10, we're moving backwards with innervation here. And that's how, if you look at the inferior part of the brain, they're moving backwards and counting. So when you're swallowing, it's the pharynx, the motion kind of in the pharynx. So where is sensory?
Is it the sensations from internal?
What's that?
I don't know, it says here, sensations from visceral internal organs and parasympathetic motor regulation of visceral.
Okay, so that is true, right? But in HEENT, where is sensory?
Is it not your uterus?
Like touching it?
Yeah.
How about the back of the pharynx? If you touch that, do you feel? Have you ever had that touch back there? Yeah, it kind of feels like a tickle. If you don't get the gag reflex, right, you may get that, but it triggers that. But you feel a sensation. You can feel in the back. Have you ever had a sore throat? Can you feel the back of your throat?
Yes.
Of course you can. You can feel pain back there too.
Yes.
It's sensory.
Yes.
1,
Oh
2.
yeah.
Still on 10. We never have that.
Yeah.
11.
That's what it is. Spinal accessory.
Spinal accessory,
Shoulder
sensory
motor.
motor.
It's this one. It's
Sensory, what
motor.
sense?
No, it's
When they give you-
motoring.
When they give you like a shoulder massage?
No, it's motor. That's what I mean.
Yeah, when you go to the Hard Rock, give me my, work on my spinal accessory. Okay? Motor, you shrug, you do that, right? Okay, last one, you see this wasn't so hard, 12?
Hypoglossal.
Motor tongue movement.
Tongue, yeah. Also, yeah, what else might be important with hypoglossal?
Tongue movement. Speech.
How else besides that, like creepy tongue thing that people do, right? Liquor or
I
something
can't
like
do
that. No, stop doing that, sir. Now, where else might you test? Well, it might be in sounds, certain
Speech.
sounds that they say require the tongue to move.
Oh.
Like what are sounds that require tongue movement? Like what letters sounds?
Like love.
Like
L. La la la.
they can say them like T.
Ta 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 ta.
Where's your tongue get?
La la ta ta
Your
ta.
tongue has to move.
Yes.
So other sounds are more.
That's funny.
I'm trying to keep them simple. Stuff here, right? I mean, we don't have borderline like unethical sound. Blowing in the ear, making that sound.
I'm just doing the R's.
It's funny.
That is just Spanish art.
Yeah, no, that's true, that's right, that would be the same thing, right?
Dr. Tom.
Oh, my God. Ever since that hard rock announcement, I don't have time for my grade. You know?
Anybody taking it?
We're thinking about it, right? I got a lot of things, the spinal accessory, I'm thinking about the ear blowing.
Funny.
So, okay, so what's more of like a guttural sound? Not like gutter language, we know what those sound like, if you this, right? But, like a guttural sound that might come from the back of the throat, like might be like Vegas, innovation.
Like gargling.
Right, that sound? You could gargle, right? Right, the sound G is a G, right? The English G, G, right? Or K, 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 K. They're very similar.
No.
You don't have to. Your tongue may be playing along, but it's not really a sound. Just do G, G. Anybody want to make that sound really serious? That's a guttural sound. That would be Vegas as well too, right? It's a pharyngeal back here too. So those would be ways when you listen to people, you also know those cranial nerves are intact if they can make those letters sounds. So we covered all the, okay, so we're gonna look for aphthous ulcers. I think I have one. Maybe I'll show it to you. But we've all seen aphthous ulcers, right? I'll show you mine. Let's see it. Okay, looking at the oropharynx, so it's important that we talked about grading the tonsils using the tongue blade, looking at the posterior pharynx. You know, when we're looking at the mouth, you know, we're looking underneath the tongue, we're looking, you may even pull the tongue side to side, you know, people get coughs, a lot of dental clinics do that, screening for oral cancer, you know, looking at teeth, right, looking at being able to look in gum health as well, being able to maybe say if there's a defect in a particular number tooth as well. So the hard palate, again, we recognize that, soft palate, those are kind of things. You know, what would you grade those tonsils? The pound-time tonsils?
Maybe 3.
Huge.
Like a 3.
You could get away with 3, like, you know, the one maybe looks like 2 and the one looks like 3 from the angle on there, which is which to you? Would you say both are 3?
The left one.
So facing it, right? You know, so really you would define that based on their right and their left.
Yeah, so it's their left.
I would, it's good to say that. You know, it's not a perfect angle. You might kind of like have a better view on there, but it is possible there, right? You may see discharge coatings on there, plaques on there. You know, it could be in extreme conditions. Could be bacterial infections, could be fungal infections, depending on their. Could even sometimes just be viral infections. You see, you may see like aphthous ulcers, like a sense of ulcerations that go in the back of the throat as well too. A lot of viruses have that effect. Right? You may even have like a hard nodule in there where you can get like a tonsillar stone as well in there.
Yeah, I've seen that.
Okay, so here we are. We talked about that. So you might see an abscess, but you're surely going to know they have an abscess, but they're going to report it. So these are looking at this. Strep may have that kind of speckled pattern back there. You know. So with strep, it's kind of best. Have you ever heard of like that center criteria? So you might use particular criteria to look that up and judge it more than looking at the throat. So you're going to pick their age. They get risks if they're very young or if they're older than 45. I'll say I'm 45, so I have it. You can see exudate or swelling on the tonsils. We'll say no. Do they have tender, swollen anterior cervical nodes? Say yes. And do they have a fever? Right. Say yes. Cough? With strep, do they usually have cough or not?
No.
They usually don't. So you're going to say cough present. They have. So then this one very nicely grades the scale for you. It gives you here 1 point on there, because you got -1 for older than 45 here. So it gives you 5 to 10% likelihood of strep, and therefore you would not treat for strep, right? Nor would you actually even do a throat culture.
I didn't know I don't know what.
right? So you would have evidence to be able to support that you shouldn't do that necessarily. Some people might do the culture anyway, but based on this, I don't, if the criteria doesn't come up high enough,
Los
so if they
charts
become a
estos,
+2, you see 11 to 17%.
they
If
don't
they're
use
a
this. What is
3,
it on mosaic?
28 to
First time I ever
35,
seen
they're
this.
gonna suggest consider RAP strep testing. So
Para
you might do it anyway,
consider
depending on
testing.
your office,
¿Eh?
some people make money
Para
off of it, so they
considerar
do it,
testing.
right? It's not probably the best practice on it.
Por eso safe, ¿no? Porque cuánto vale un strep de eso.
Of course. A lot of the physicians just treat clinically.
So infectious mononucleosis,
So
okay, we might see
treatment.
things like this, right? So of course, being able to distinguish between what are life-threatening conditions, common conditions, and other conditions, right? Any abscess back there could be very problematic for inflammation
Yeah,
and
very
breathing.
considerable
They're gonna,
abscess.
obviously, they may come in with very severe symptoms when they have those type of things.
Man, yo tuve un niño lo tuve que no podía ni abrir la boca. Tenía kissing tonsils.
We talked
Estaba,
about
que
that.
hasta estaba
Testing
like
for
babeando.
mononucleosis.
Se tuvo que ir para el hospital.
This is these two slightly
We
familiar,
gave him,
right?
sí, le
So we know
dimos,
with
le
the neck,
dimos
we're
ya, le
expecting
dimos una
that.
inyección,
We're
no
doing
le
the
tenemos
lymph
salir
nodes
más, we
on
should
there.
have, I would
This
have.
one's the lymph nodes of video.
And then we gave him a shot of Bystander y lo mandamos para el hospital.
And we'll go through
Al
that.
niño.
Assessing the neck.
Now you'll assess the neck,
Parecido.
beginning with inspection.
This is like a textbook.
The patient's neck should hold his head erect and midline. It should have symmetrical muscles and no swelling or masses. If you see swelling below the jaw area, palpate this area to check for a parotid gland problem. Now assess the neck's active range of motion by having the patient touch his chin to his chest, turn his head to the right and left, tip his head toward his right shoulder and toward his left shoulder, and tilt his head backward. All of these movements should be smooth and painless. Next, assess the spinal accessory nerve. Apply resistance to the patient's shoulders as he shrugs them. The shoulder muscles should be symmetrical and able to overcome your resistance. Now have the patient turn his head to one side as you apply resistance to the side of his chin. Then have him turn his head to the other side as you apply resistance to the opposite side of the chin. Note the contraction of the opposite sternomastoid muscle and the force of the movement against your hand. Movements should be equally strong. Next, move on to the lymph nodes in the neck. Hold the heads of both hands. Bilaterally palpate the nodes using a circular motion. Palpate the lymph nodes in this sequence: preauricular,
Yep.
posterior auricular, occipital,
Occipital, back of the head, right? But occiput.
submental, submandibular,
Should be able to identify all this.
superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Note the size, shape, consistency, mobility, and tenderness of the nodes. Be sure to compare one side to the other. Normally, the lymph nodes are small, soft, non-tender, and movable. If you detect swelling or tenderness, search for a possible cause. Now inspect the jugular veins using tangential lighting. With the patient supine and his head elevated 30 degrees and turned away from you, internal jugular vein distension may be visible. Observe the jugular vein pulsations. They should undulate softly and may decrease with inspiration. Note unusually prominent pulsations. Now, with the patient sitting up, identify the trachea by locating the sternal notch and sliding your fingers to each side of it. The trachea should be midline and symmetrical. Stand in front of the patient. Use the fingers of your left hand to push the thyroid gland to the right. Curve the fingers of your right hand between the trachea and the sternocleidomastoid muscle. Then ask the patient to extend his neck and swallow. You should feel the thyroid move up and down as he swallows. Then palpate the thyroid gland from behind. Place the fingers of both hands on the patient's neck with your index fingers just below the cricoid. Palpate both lobes and the isthmus. Instruct the patient to sit and swallow during the exam. Note the size, shape, and consistency of the thyroid. If the thyroid is enlarged, auscultate it for bruits with the bell of your stethoscope. A bruit is a blowing sound caused by turbulent blood flow. Next, observe the carotid arteries for visible pulsations. Gently palpate the carotid arteries using your index and middle fingers. Remember to palpate one carotid artery at a time. Otherwise, you could block blood flow to the brain. Don't press too hard over the carotid sinus area located higher in the neck, because this could cause vagal stimulation, which could slow the patient's heart rate. Next, have the patient take a deep breath and hold it as you listen to the carotid artery with the bell of your stethoscope. You should not hear a bruit.
So you should know all the names of those different lymph nodes and how to quickly run through them. We'll run through them as well. Lymph nodes, yep. We're going to be describing the general size of them. You know, the soft, the consistency of them, right? How do they feel? What if you can define them there? Are they moving or are they fixed in position? Are they tender? You know, is there any sign of erythema? You know, you may see the redness or that may be pain could be related to that as well too. So we talked about this, the thyroid. That's enlarged. So yes, this is actually a very common finding when you see people kind of present like this, right? You know, this is just from visual inspection. You kind of look and you kind of see like a fullness there. All right, anybody when I see kind of fullness in there, I always get an ultrasound there. You know, maybe it's just tissue, right? It may not be the thyroid, but because really I'm finding you shouldn't feel the thyroid. That's a normal finding. It's not that you're feeling the thyroid. You're checking to see if you can feel it as well too. Okay, so hyper versus hypothyroidism on there as well too. So obviously, you know, just be kind of familiar with some of the classic symptoms of these type of things. You know, hyper is people a little too fast. You know, the eyes are bulging out, sweating, rapid heartbeat could be signs of these too. Usually it's weight loss. Most people don't have hyperthyroid. They tend to be hypothyroid. You know, causes of hyperthyroid might be like type of thyroid cancers or masses on there, versus most people are hypothyroid, where, you know, they're losing hair, maybe even hair on the eyebrows. They're gaining weight. Obviously, there's many reasons to gain weight. And constipation could be a sign of it. You know, many reasons to be constipated. Nails, you're going to be looking at for people as well too. There we go. You want to take like a 5-minute break or a 10-minute break on this, and then we'll go into the physical?
Yep.
So we'll go over this in